Hi, everyone. Gabby here, owner and clinical director of Recovered and Restored Eating Disorder Therapy Center. I wanted to jump on really quick and say hi. I also am here with our amazing clinician, Breanna, and she is here with us today. Bree, tell us a little more about you and what you do at Recovered and Restored.
Yeah, so I am one of the eating disorder and trauma specialists at Recovered and Restored, and I primarily work with teen girls, young adults struggling with eating disorders, body image, depression, anxiety, PTSD, lots of things. And I originally interned here actually, and then it turned into a full-time position, and so I think I'm coming up on like a year and a half-ish or almost 2 years, something like that.
Yeah.
So that's me in a nutshell at Recovered and Restored.
Yes, almost 2 years as a full-time clinician, but I think this September would be 3 years technically that you've been at Recovered and Restored.
Yeah.
Yeah.
If we're counting intern years, then yes.
Yeah. Yes. Which
Does
is
not feel
awesome.
that. They like flew by.
Oh, not at all. Time like is just like a concept.
Oh, for real. Yeah. Yeah. It just gets faster as you, and I'm not like still young, but like as you get older, like it just starts flying by, and yeah, it all blends together.
Totally. Yes. So you started telling us about your role. Tell us more. Tell us about like where you went to school, like all the things, where you're at in like your licensure process, your trainings, all the things.
Yeah, so I received my bachelor's from Arcadia University in psychology. And then I went on to earn my master's in clinical mental health counseling from Gwynedd Mercy University. And since then, I then started part of that, I was interning here and then until graduation. And then when I came on full time, I got formally trained in cognitive behavioral therapy, dialectical behavior therapy, exposure and response prevention, and recently level 1 EMDR, which is super exciting. And so I incorporate all of those approaches and models into when I work with clients. I don't necessarily work adherently to just one of those, except EMDR, that is a more specific type of approach that I do work adherently to. But otherwise, I kind of pull different things depending on what's needed and, what the client is coming in with. And then as far as licensure, I'm currently pre-licensed, but I'm almost there. I think I'm like more than halfway. We're really close to it. Hopefully by summertime, I should be there. So that'll be the newest thing. And then hopefully more trainings in the future and just continuing to grow my expertise and all that.
Yeah. That's pretty impressive, right? Like you're pretty great.
It literally feels like I was just turning in my last few assignments in grad school and like picking course selection. Like it just doesn't, it's wild to just think like, oh yeah, I'm almost licensed. So it's like such a huge milestone that it's a big deal.
It is a big deal. Yes. And you mentioned that you like working, God bless, with the tweens and the teens and the young adults. So tell me more about that.
Yes, I do love working with all of my clients. I love the teen to young adult age. Teens, though, they hold a very, very special place in my heart. And that, to like spare a lot of details, I struggled a lot when I was 16, 17 years old. And that was like really the thick of my struggle with various things and things I had been through and was going through. And I just remember feeling so confused and alone at that time. And it took some time to get the courage to ask for help, which was really hard to do. But when I did, unfortunately, I had responses that were along the lines of, well, all teens are sad and, it's just a phase and you'll grow out of it. And that's just totally normal for a teenager and, it's just a phase. And like, hopefully that's not everyone's experience, but that really stuck with me. And I had this like defeated feeling that my chance was kind of lost at getting help. And so I was kind of stuck in this mindset of that, we hear a lot with clients like the sick enough mentality. And I was kind of stuck with, well, if I'm not exhibiting X, Y, and Z, it must not be that bad, or it's not legit.
Which is not true.
It's not true at all.
No.
It's such a trap to fall into, and you don't even know you're consciously going there. Like it's not something you're aware of that's happening. But I was stuck in that place for a very long time, and that was like in my early years of high school. And then by my senior year of high school, I took intro to psych because I was like genuinely interested, and also for like a more sad reason, I was like, maybe I can find like some answers in this class. And it did open my eyes to a lot. A lot of things just started to make sense for me, and I felt a little less alone, but unfortunately I just felt like no one would believe me. So I didn't really ask for help again at that time, but instead I kind of, with all the information I was learning, I kind of made this promise to myself that if I ever make it through this, and if I ever make it through the other side, then I want to be there for other teens, other girls who are struggling with whatever it is that they're struggling. But the things that really hit close to home for me, and, hopefully be one less voice in the crowd saying it's just a phase and you'll grow out of it. Because when I hear that, I think like, yeah, talking back to your parents, or like coming back after curfew is like a phase, like you grow out of that. But so
Health is not a
kind of,
phase.
yeah. And so that was kind of my core why as to like why that population is so special to me. And then if I'm here, I made it through, and I went on to be a therapist. And this sounds so dramatic, but like it's
No.
so surreal to me that I'm here, and like that this is my life, just because it just didn't feel like that would ever happen for me. And so I hope I never take my work for granted. It's such a blessing. And of course, in college, I had the all too familiar identity crisis that one has with like, wait, do I really want to do this? What do I want to do with my life? But I just brought myself back to like, why did I pursue this in the first place, and why it's important? And now here we are. And I wouldn't trade anything, like just because it brought me to here. And that's just something that 16-year-old version of myself does heal a little bit more every time that I get to support somebody else. And yeah. So that's like my core reason why this was like so important to me, why this field is so important.
I love that. That is so beautiful. And also, if you are listening and you hear Bree's brave story and you're in the thick of it, there is another side.
There it is. There's always someone rooting for you, even if you don't know them yet. But you're never, ever, ever alone. Some of the things we get certain thoughts or certain experiences, and we're like, I feel like I'm the only one that thinks this or is going through this. And it's just not true. You just have to hold on, and find those things that keep you putting one foot in front of the other, and you will experience healing. Like it's possible for everyone. So
yes, totally. One of my favorite sayings, and this is like so cliche, but it is true, like it can't rain forever.
Mm-hmm.
It's
no
true.
rain, no flowers along the lines there. Yeah,
Totally.
it's so true. It's so true. It's temporary. Unfortunately, some of the things are like a longer temporary
Than we would like, for sure, for sure. And this is not to say that in the midst of your pain that you aren't hurting, because we know you are, because we both have totally been there. But just know that there is another side of that, and your pain can have a purpose if you want it to.
Absolutely. Absolutely. It's not for nothing. Of course, no one deserves any of it.
No,
it's painful, but it's not for nothing. There's a way through.
Yes, definitely. So tell us about a session with you. I always joke whenever I talk to Bree in supervision, or whenever she sends me like a video that I ask for, I'm like, God, Bree, I want to be your client. So just tell me all about a session with you. Make me feel like your client right now.
Oh my gosh, I love that. It's actually so true. I'm like, yeah, we do talk about that a lot.
We do.
No, it's the greatest compliment. Yeah. So like, this is such an annoying answer, but it does vary person to person.
Totally.
I do take into account what a person's coming in with, their previous therapy experiences, and how that's impacted them. Honestly, how they view therapy. A lot of times people have gotten different messages of what that is. But pretty much like logistically, the first session or two is like the intake. So that's a lot of questions about the client and what they're coming in with, their history, goals, all of that. And then, like I had mentioned earlier, with the different approaches that I use and the things that I'm trained in, I'll, use different skills of what's needed depending what they're going through, like, what we're working on. So there is some of that like skills based and like psychoeducation when needed. But all of that aside, I mean, with every single client, I always value the therapeutic relationship. I think that is so important for trust and for someone to open up and to ultimately just trust you with what they're sharing. But I always bring validation, empathy, non-judgment, genuineness. Like these are huge values of mine. And I just really value like the humanness in all of us. And so I really try to make a conscious effort to show up as a human as well, and just be person to person. Of course, professional relationship, but knowing that you're not talking to like a thing or like a wall or a person sitting on their high horse or anything like that. I have certain knowledge in some things, but that doesn't make me an expert on you or anything that you're coming in with. And so that's just really what you can expect is, it's a little mix of, we have goals and we work on skills, and I can, give you some things to take with you, but there's also just this shared space of, sitting with feelings and sitting through those hard times and knowing that your story can be safely held and that, there's a lot of compassion involved.
That is one feedback I get about Bree all the time, is that she is full of compassion and warmth. So if you show up for a session with Bree, at the very minimum, although she does so much more, you are going to get compassion and warmth. And I know that for sure.
Thank you. Those are things I look for in a therapist. I can't imagine like if someone was just like this the whole time. I would be like, oh, okay, I feel like I can't open up. I think we all need that. I think we need more of that. I think just, in our world, we just need more of that. And so, I can be that, then I bring that, and that's just so important to me. And I really see how much it really helps people, and you can trust is something that I don't expect you to just give me right off the bat. Like, I'm not entitled to anyone's story or anyone's information. That's something that I want people to feel safe to be able to open up with. And so I always lead with that as well.
Yeah. And I think therapeutic alliance and building like trust and rapport is one of the biggest predictors of recovery. So like, if we can establish that, you've got this. So like, that's huge.
Yes. I mean, eating disorders are so isolating. Mental illness is so isolating. Even just struggles, like just
being a person, right? Being a person is hard.
It's hard. It's hard.
Yeah, it's really hard.
So yeah, like fostering that relationship. And I hope that this doesn't sound like it's coming of like, oh, I play this role if I try to force a relationship.
Not at all.
It's really, I think exactly. There might be some people out there who, do force it, but like it's genuine coming in a session with me of like, I really try to meet you where you're at and foster that. So
I love that. And I think that definitely comes across. So you are level 1 EMDR trained, which is so exciting. I will say Bree is currently the only member of the Recovered and Restored staff who is EMDR trained, although other people have expressed interest, which is really cool. So tell me about it. I want to know what happens, what is it, all the things.
Yeah. So EMDR stands for eye movement desensitization reprocessing. Super long name. That's why we call it EMDR. But one of those therapies, I think that's just so hard to explain sometimes without having the person feel like they're drinking from a fire hose. It's just like a lot of information. So hopefully it can be more of like a sprinkler and just like give it to you in like bite-sized pieces. I've just found that the best way to explain it initially is basically EMDR in a nutshell is it uses eye movements and other forms of bilateral stimulation. So what that means is you can use like tactile approaches. So sometimes that's like tapping, using buzzers in your hand, anything that stimulates like either side of your body, like alternating. So for example, with buzzers, your left and your right hand will alternate buzzing. That's going off while you're, either watching your therapist's fingers go like this, you're watching a ball on a screen through a specified EMDR website that we use. Anything can just like stimulate the eye movements. And so with all of that happening, what's happening internally is that your brain is reprocessing traumatic memories that we would have identified that you want to work through prior to all of this. And through that reprocessing over time, the goal is that you get desensitized to the emotional and like somatic ways that your body has been storing it, that emotional charge that it has. So that's kind of it in a nutshell. And then this relates to eating disorders, where it's effective for eating disorders because oftentimes eating disorders develop as a result of trauma. Now, of course, this is not everyone's story, and your experience still 100% valid, even if there's no trauma behind that. But for this approach specifically, if there is underlying trauma, EMDR focuses on going to the root of those and reprocessing those traumatic memories at your own pace as well. There's no timeline for this. And then ultimately what happens is that can alleviate the use of your symptoms in your eating disorder as a coping mechanism. Which is how it can ultimately help you heal from your eating disorder, because you're getting to the root of maybe what's been underneath basically what your eating disorder has meant for you, and what it's been,
how it's presented.
Exactly. So
yeah.
So hopefully that made sense. I know it's really hard to digest EMDR because it's a lot.
No, that made so much sense. And I think sometimes even just having an eating disorder itself is a trauma, and we kind of get lost in the pathology of it, of like, oh, they just have an eating disorder. That's traumatic.
Absolutely.
That is traumatic. And yeah, not everyone's eating disorder is a result of trauma. Although I've been doing this 11 years, I don't know that I've really met many people that there isn't a correlation. But again, correlation and causation are two separate things. But if you are struggling with a trauma, with an eating disorder or anything, EMDR could be a great fit.
Absolutely. And I do encourage anybody who's watching this, who's interested or is wondering, maybe you haven't gotten to like, oh, why is, what is my eating disorder? What's the purpose, or like, what has it been serving me in some way? Sometimes there's just a lot of misconceptions around what qualifies as trauma. And I don't want to, do any like
talk about it.
We didn't give like a trigger warning, so I'll, try to be mindful of that. But, just like we hear that the big name traumas, I guess, that can happen.
And those big T's.
Exactly. Those are absolutely traumas, but there are so many other experiences with trauma. And it's really, anything that has caused like an adverse life event that has caused lasting and detrimental change in your life. And so really, I encourage you to ask, and kind of have that conversation with your therapist or with a trusted support and someone who's knowledgeable in it, because sometimes we invalidate things we've been through because we feel like it's not this thing, or it doesn't fit in this box. And so I just, want to put that out there as well. It's exactly like you said, there's often a trauma history behind it. Of course, sometimes there's not, and that's
right. That's okay.
But
so. Whether it's a big T or little T or no T's at all, we would love to help. So, okay, what is the greatest lesson you have learned? And what do you hope others in their healing process can learn?
Yes, I love this question because I think, well, first of all, we hear a lot, or we say a lot, like healing is not linear, and it's so entirely true.
But it's true, right? Like as much as that statement is overused, and it's like 1,000% true.
So I love this question because I think there's a lot of misconceptions as well about what healing should look like, and especially the world of social media and Pinterest, and it should
Instagram and TikTok and all the things.
There's like this aesthetic now around like healing, when it's actually the most messy thing.
It's so messy, right? It's so messy. It's funny you say that because I was talking with my friend Sarah at Reclaim Therapy. They are also EMDR trained and amazing. And I was telling her how I really struggle to make reels and TikToks and all the things because I don't have an aesthetic home. I have a 7-month-old, so everything is everywhere. And so I'm like, what are these people like? Really, like, what are these people like videoing? Like, where do they get these backgrounds? Like, that's just not what my life looks like. But I think there is this new trend on TikTok and Instagram where like it can be a little messy. So maybe I'll find my vibe. However, healing is always messy.
Yes, no, 100%. I feel like I've seen things like that of like on Instagram or reels where it's like, can we normalize like normal homes, or can we normalize normal? Yes.
Help a girl out. I'm trying it.
Exactly. And that's the more shared experiences, like it's all messy. And, of course there's these wonderful on top of the world feelings and maybe moments you have along your journey that should be celebrated, but day to day, like it doesn't have to be perfect. There's no timeline. Having a slip up, falling down again does not mean everything you did was fake, or it doesn't count. And so I guess just in a nutshell, the greatest thing I've learned is that it's often a lifelong process. And I know right off the bat, that can sound like a burden of like, oh, I have to do this the rest of my life. When you really step back and like look at the human experience, like we we have the ability to grow and change and evolve and feel a vast range of emotions. And so when you have that type of experience, it's doing yourself a disservice to hold yourself to the standard of, I'm going to be, once I get here, then I'll be happy, or I'm going to be happy 100% of the time. Because with change and comes growth and adjustment, and then new lessons, and you kind of adjust to that as well. So I guess the greatest thing I've learned was taking it day by day and letting myself show up in the way that I need, and meeting myself where I'm at, and that some days maybe I can handle a little bit more, and other days not it, and that's fine. And that makes me human. It makes you human. And so I guess, what I hope then for other people is that they just relieve themselves of the pressure and the burden of, the comparison trap, and just needing it to look or be done by a certain way. Again, an overused thing is like, you're not a person who needs to be fixed. But again,
totally. So true. Yes. Yes.
Yeah. I do love this quote out there. I'm sure we've heard it, but I'm happy, healing, and hurting at the same time. And every time I use that with clients, they're like, oh my gosh, that's exactly how I feel.
Yeah.
Because it's like the power of and. You can hold so many truths at the same time. And it doesn't discount the very real pain you're experiencing and going through, but it also doesn't mean you can't have true moments of joy along the way. And you can have all of these different things happening at once. So.
Yeah, absolutely. And like one thing I've learned to like add on to what you're saying is that like part of being human is suffering. There will be suffering in some capacity, not because we want you to suffer, but because life is hard. Being human is hard and messy, but learning to hold space for both emotions or all the emotions can be really healing. So you can be sad and you can be happy, and all of the emotions are always welcome. And also when we're able to heal from our eating disorders, we can relearn how to regulate and feel these emotions. And I can promise you, and I'm sure Bree could say this too, those emotions are worth it. All of them are worth it.
Yeah. Yeah. Again, another quote, or like another way of saying it, is they say you have to feel it to heal it.
Yeah, totally.
Entirely true. And no one wants to sit with hard emotions. I get it.
No, same. No, but
there's a certain level of grieving that comes with healing and recovery, and that's so necessary, and it's so uncomfortable and hard, but it's just part of the process. And hoping people hear this as like, healing is a gift that you give yourself. You don't choose, like you said, we all suffer, so you don't choose what happens to you. You don't choose how your body survives it. We have these ingrained survival mechanisms. We don't choose that, but you choose, what you want to do going forward, and kind of how you want to show up for yourself, and being gentle with yourself, of course, along the way. And all of that. So
yes, 100%. So when you're not in session, because you're a pretty fabulous human, tell us what you're doing.
Yes. So I am an introvert. So I love all things indoors. I love to be in my own space.
Yeah.
I love sleeping in. I never really grew out of that. Like,
good for you.
Love to sleep in. I love to read, watch Netflix. I love animals. So I love spending time with all of my little fur children.
Let's talk about them. We need to pause. They need a moment. Let's discuss all of them.
Yeah. So my first baby was Ace. He's on our website.
We love him. He is king.
He is thriving. He's living his best life. His retirement years. He's doing great. And
love that.
Unfortunately, when I moved out, he couldn't come with me. So he is being loved and cared for by my parents, but I do make a visit to him like every week. So he's still.
How could you not? He's so perfect.
Yeah, he still loves me the most. So it's fine.
Obviously.
But he is my first baby. Love him so much. And then I also have 2 guinea pigs. So
yeah, tell us about them. They need their spotlight.
They do. They're spunky little things. I have one that's like guinea pigs have personalities. I know sometimes people think like, oh, it's a guinea pig, but no, they have personalities. So one is like super quiet, like doesn't cause any destruction, all the things. The other one, Tasmanian devil, like it just all the things. And he loves his food, loves his treats. Like they're such a joy, like just watching them and like being with them. It's so cute. I just love animals. I would have cats, dogs, guinea pigs, bunny. I would have all of them. So
yeah, I love that. Yeah. And what else do you like to do?
definitely hanging out with my sisters. I
Yeah.
love calling my mom and my dad. I love like chatting with them. Just hanging out with my people. I also have, I don't know if I've shared this before, but I like to paint. I don't do it frequently,
Yes. Yeah.
but it was a talent I didn't know I had until I like had to like fill 2 credits in college. And I was like, all right, I'll just take a painting class, just get it
Yeah.
over with. And I was like, oh, I painted my dog and it like came out so nice.
Yeah.
It's also just like really therapeutic to just do that and really
Yeah.
calming.
Yeah.
Also, you don't have to, even if like you don't have to be good at it. Like I'm not no Picasso over here, but like I do.
I was just about to call you that. That's so funny. I was like, Bree, our Picasso on staff. No.
Yes. No, I am not. But I can't draw things to save my life.
That's
But I
so
can,
interesting.
yeah, yeah. So
Huh.
I don't know, but I do like doing that. I have like painting supplies, so I'll like go to that
Yeah.
every now and then. But
I
yeah,
love that.
yeah.
Yay. And the holidays are coming up.
Yay.
So tell me all about what are some of your favorite holiday traditions and holiday treats, because we know that all foods fit.
All foods fit all the time. Honestly, I'll start there because one of my favorites is the iced peppermint mocha lattes from with whipped cream and sprinkles from Starbucks.
Yeah.
But all foods fit, right? But I wish they had that year round, like it's only on like around this time of the year. So I definitely get that. I try to, always make room for that. And then my mom would make these, we call them snowball cookies. That's like definitely not the
Yeah.
real name for it, but
That's okay.
they're these like shortbread pecan cookies, like doused in
Ooh,
powdered sugar.
yum.
Literally the best things ever. I love them. So those are like my 2 favorite things. And then tradition wise, 3 years ago, I started in my family like our Christmas game of games. So I host this like game night
I
from
love
Etsy.
this.
It's so fun. Shout out Etsy. They have like everything on there.
Yes.
So we do like it's all Christmas themed. So because we celebrate Christmas. So we do Family Feud, we do Pictionary, charades, like a finish the lyric. So yeah, it's like this is like our 3rd year. We just had it last weekend. Yeah, last weekend. So we do that. But prior to that, my dad is a huge fan of the Chevy Chase Christmas Vacation.
Oh, yeah.
Yeah, every Christmas Eve he kind of started that. So we would watch that for like as long as I can remember. So those are like our two like little tradition things we do. Yeah.
I love that. Any tips for anyone as they navigate the holidays? Because that can be really hard.
Yeah, I think kind of what we were talking about earlier, just one, being gentle with yourself and kind of knowing that it's hard to hear sometimes like, oh, this is the most wonderful time of the year. And that might be true for some people. And it brings up a lot of like those heavier, harder feelings. And so practicing that power of and like holding multiple truths for yourself and letting yourself just feel all the things that are coming up and knowing that you do not need to mask or slap on a smile when you're having like a really hard day. To just give yourself some TLC, like some tender love and care on those days. But that would be like my biggest tip is, that, and also to reach out for support, find somebody, whether that's a therapist or, somebody in your life that you feel like you can trust and, just let them know how you're feeling. And then for other people on how to support others, I think just check in on people.
Yes. Yeah.
Like, hey, how are you doing? Or I've been thinking about you, or this made me think of you. How are things?
Yeah.
Just like those simple things, that sometimes we don't do enough of. So I think that would be like my biggest tip.
I think those are great tips. And I always say, check on your strong friends, because just because someone is strong and they carry it well doesn't mean it's not heavy.
Absolutely.
So yes, check on all your friends. I think that is, and family and all the people that matter to you, because I think that is such a powerful tool. Or let people check on you.
Yes. Accept help.
You are worthy of that.
Absolutely.
And you are not a burden. I feel like I've been saying that a lot lately, so I'll say it here. You are not a burden. Your struggle is not a burden. Your eating disorder is not a burden. Whatever you're going through, you are just a human, like we talked about today, struggling, and that is okay.
Exactly. Yeah, I 100% agree. No one's a burden. And
No.
And I have that conversation. I feel like that comes up a lot in sessions as well. There's usually this underlying like I don't want to say anything because I'm afraid, I don't want to burden people.
Yeah. You're not a burden. Also, people have the ability to say, I'm not able to do that, but I can do this. Right? People also have the ability to communicate their wants, needs, or feelings in moments as well. We have to give them those opportunities. And you also get in return an ability to possibly be supported. So it's worth trying. And a lot of times I think you'll be pleasantly surprised that people do want to show up for you. And when you tell them how, they're more able to do it.
Oh, absolutely. And also like the showing up aspect of just sitting with someone in that. Like, we don't always have to fix something. We don't always have to find solutions unless a person's explicitly asking for that. Or,
Yes,
you
totally.
always ask, hey, do you need someone to sit with you? Or, do you need some advice, and kind of just laying it out there so that they can choose. But yeah, just like supporting and showing up and just being in the presence of someone can be so helpful.
Yes, totally. Well, thank you for coming on today. This was so fun.
It was. Thank you so much.
Great job. And if anyone wants to work with Bree, you can reach out to us at recoveredandrestoredtherapy.com. You can comment below, but I will be honest that I'm not that great with YouTube yet. So probably better head to our website, or you can message us at Gabrielle LPC or at Recovered and Restored on Instagram, or you can email Bree. She'll ultimately send you to me, but her email is
but it's open.
Breanna is her full name. Bree. I was like, what is her email?
I know.
Breanna.
No one says it. It's BREANNA
at recoveredandrestoredtherapy.com. So we would love to work with you. Also, please remember that these videos are not a supplement for therapy. We hope that this adds some value to your day and help makes your recovery just a little bit easier. But if you are looking for services, we would love to work with you or get you connected with someone who can. And I hope that everyone has a great day and beautiful holiday season. Bye, guys.